All right, hello everyone. We'll go ahead and get started with our COVID-19 media briefing. Thank you all for joining us. Special thank you to all those who serve, and for Veterans Day. We sent out a little release today, just thanking the National Guard. If you have a chance to read that, they've been critical support for the health district. So just want to say thanks again to them. We have District Health Officer Kevin Dick on the phone or on the chat today, so I'll go ahead and give it to him, and we'll go with questions after he's done. Kevin, if you're ready.
Yes, thank you, Scott. I hope everybody can hear me okay. I am in my workplace, and so therefore I am wearing a mask, even though I am socially isolated at the moment, in accordance with the governor's direction from his press conference last night. I also want to express my thanks and gratitude to all of our veterans for their service, and particularly to the Nevada National Guard. They contacted us 7 months ago today. It was April 11th, and asked if they could come by and check out our post operations for our drive-through testing. And within a few hours, they were here and working to come up to speed with how we were operating. And within a week, they had joined us in our response effort. And I'll never forget the morning that they arrived as we were doing our command briefing and walked into our briefing room. It was so great to see all of those men and women in fatigues coming to bolster our response. And they've been embedded in our operations since then. They are willing to step up and do anything within their mission. And they are helping us with our drive-through testing at the post. They are working as part of our disease investigation staff. They involved in the contact tracing efforts, providing data entry and input support for us, and also working in our call center operations and with the scheduling and reporting out of results from our testing. So they've been great resource and team members working with us since that time, and we're certainly going to miss them if they are going to be ending their deployment in December. We would certainly welcome for them to be engaged with us longer than that. So I hope they all have a very good Veterans Day today. Our 7-day moving average for new cases stands at 337.4. So we have very high levels of disease transmission, alarming levels that are occurring in Washoe County. For some perspective, a week ago, we were at 199. So now at 337.4. And I can tell you since October 1st, our levels of new cases that we're having each day are at about 3.5 times what they were just at the beginning of October. So we have widespread community transmission that's occurring. And I want to echo the governor's message, and I thank him for his stay-at-home 2.0 message yesterday, that with all of the cases that are out there in our community, and just of the ones that we've tested and confirmed, we've got over 3,800 active cases. It's very important for people to stay home as much as possible and to limit any excursions outside of your household to be for essential needs, either work, getting food, or medical attention and medicine. So if we can give this 2 weeks and do our best, let's see if we can make an impact in the numbers. I know nobody wants to be closing down businesses again, but I think it's an important message that we have, that if we cannot do this, that there will be other actions that are necessary to control the spread of disease that we're seeing. The hospitalizations are increasing. Many of you saw Dr. Tony Slonim last night with the governor sharing his personal story as well as his concerns with their hospital capacity. At the Nevada Hospital Association, they reported that we had 167 confirmed cases hospitalized in our Washoe County hospitals. We had another 37 that were suspect COVID-19 cases that were awaiting results. We had in our ICU beds 59 COVID-19 or suspect COVID-19 patients. And of all of the ICU patients in the hospitals that were reported, that represents 40% of the ICU hospitalizations. So this level of COVID impact on the hospitals is of concern. And it's also important to recognize that the COVID-19 patients that are hospitalized have longer hospital stays than your average patient within the hospitals. So that further exacerbates the burden on our hospital system. So it's very important for us all to take this quite seriously and do everything that we can to prevent the spread and prevent our healthcare system from being overwhelmed with the high number of cases that we have that are occurring. The county is continuing to be flagged by the county tracking system of the state. And so we will again be meeting with the task force on Thursday. As a reminder, we have rolled back gatherings, public gatherings of only 50 people or less. I would encourage people not to attend gatherings in accordance with the governor's stay-at-home 2.0. But that has been rolled back, and I wanted to clarify because earlier in October we had said we were going to limit the gatherings to under 250 when the governor had come out with that directive until we could further evaluate. We are not further evaluating at this point. The limit is that 50, and for the foreseeable future until we get much reduction in the transmission that's occurring in the community. As a reminder, the governor's directive also limits private gatherings to 10 people indoors or 20 people outdoors. I know we have the Thanksgiving holiday that's quickly approaching, and I know that there are difficult choices that many of us have to make about extended family gatherings and family and friends occurring over the holiday. And it's a wonderful tradition that we have to have those Thanksgiving gatherings. And, we've all enjoyed those over the years. But this year, I think it's very important for people to reconsider those plans and to work to minimize those gatherings and just enjoy the people that you live with in your household over that Thanksgiving holiday and share it with only them. Many of these gatherings traditionally involve older people in our families, the more vulnerable populations that are more susceptible to severe outcomes and death from COVID-19. Sadly, we have had family gatherings that have occurred while we've had COVID-19 that have resulted in deaths of family members in these households that were bringing together households that weren't living together, extended families. So I really would like to caution people and ask that you not have those kinds of extended gatherings over this Thanksgiving holiday, and protect yourselves and your loved ones in our community. With that, I guess I'll wrap it up, and I'll turn it over back to you, Scott, if we have questions.
Thank you, Kevin. Feel free if you have a question, unmute yourself and fire away.
This is Paul Nelson with 2 News. Kevin, do you think 2 weeks is a long enough time to turn these cases around?
I suspect that it's probably not enough time to get us really turned around, but hopefully we can see some start of numbers beginning to move in the right direction.
Hi, Kevin. This is Kenzie with News 4. We've heard of several cases at area high schools where there was massive Halloween parties where potentially 200, 300, 400 students were exposed, specifically at Reed High School where the whole school is on distance learning. What's the health district doing about that? And is there any sort of enforcement that can be done?
Well, I think we've been messaging quite consistently not to be having those gatherings, and the city is enforcing party gatherings. The cities are, and so I guess what I would encourage is if people see these events happening, to contact the non-emergency police number to report them so that a patrol could go by and action could be taken to disrupt these large gatherings. Unfortunately, there are some people in our community that are ignoring our messaging and under the impression that COVID-19 isn't a big deal, that they need to be worried about and to be working together to address. I think what we're seeing happening with our hospital system now is a stark reminder that COVID-19 is very real and we all need to be concerned and paying attention to it.
Hi, Kevin. Shaditi from This Is Reno. I'd like to know about the contact tracing efforts right now. My understanding from last few meetings is that it isn't enough right now with Washoe County. So if you could just walk me through that, please.
Well, as I mentioned, we've got about 3.5 times as many cases now as we did at the beginning of October. And it's just impossible for us to keep up with that kind of a spread and increase in cases. And I think what we have here with COVID-19 is a wildfire that's happening. And contact tracing is sending us out to put out individual trees that are on fire. And that does not help us to control a wildfire. Contact tracing it is feasible when we have knocked the disease rates down to a level that we can quickly identify where a case is occurring and respond to suppress that outbreak. So my analogy would be, once you have contained a wildfire and you have smoldering hotspots and you have fire crews that are going out and identifying those hotspots and putting them out, that's the role of contact tracing in controlling a pandemic like this. And with the number of cases, it's simply not a feasible strategy to be the one that's going to stop COVID-19. And that's why it's so important that everybody play their role in the prevention to suppress the spread of the disease. That those activities are the fire lines, the backfires, the airdrops that we use for controlling wildfires. And we need everybody in the community engaged in controlling our COVID-19 wildfire. With that said, we are working, and the state is in conjunction with other Western states, on how can we adjust our strategy on the contact tracing. We're already focusing on pediatric cases and the schools, and we're currently overwhelmed with those, but we're going to continue with that focus. And we're also going to be trying to focus on, as a priority, households that have multiple cases, where we can get more connection with cases and monitoring of them through that household versus other individual cases. And then again, also a priority on our first responders and healthcare providers. And we are working with the state on trying to develop a platform that we could use that would allow more automation of the disease investigation effort for a large segment of the cases that are identified, rather than getting a personal interview to have a questionnaire to fill out that could go on to the contact tracing staff to identify close contacts. So it's far from ideal, but we're trying to adjust our strategy and focus on the areas where we think we could be the most effective.
Kevin, it's Kenzie again.
I'm sorry, I am not finished yet. I had just one more question. So does any of those strategies involve maybe putting some restrictions on the super spreader events or some hotspots? Say, for example, Stanford University did a few research and they could basically connect a lot of cases to some of the political events. So does the strategy involve any of those things? And once you have figured out a super spreader event or a hotspot, what are you going to do about that?
So it does not. And in order to be able to have that kind of a focus on super spreader events, et cetera, we would have to have much reduced level of disease transmission. With the level of disease transmission, we have it occurring everywhere. It's not a matter of targeting a super spreader event. And in fact, it's becoming more difficult to identify where spread is occurring because we have positive cases that we do our disease investigation on, and they have had multiple contacts with other positive cases separately, and we don't know from who they received the disease. So it's out there in our community, and we need to take the precautions that the governor outlined to reduce the spread.
Thank you.
Hi, Kevin. It's Kenzie again. You guys announced the decision to suspend asymptomatic testing for the time being earlier this week. Can you just talk about that and why that decision had to be made at this time?
Yeah, thank you, Kenzie. The decision was a tough one to make, but we felt it was necessary because of both the demand for testing that we were receiving for people coming through our post and the labs having turnaround time delays because of lack of capacity to keep up with the throughput of tests that they were receiving. And so in order to get people that were symptomatic tested as soon as possible and not be delayed several days because of lack of capacity at the post, we decided that we needed to move to not doing the asymptomatic testing at this time. And with the higher numbers of people still that are coming through our post that are symptomatic, also that creates that burden on the lab or the labs to keep up with the demand for their limited testing capacity. And so in order to get the results more quickly from the labs, or at least not to have it fall further behind, we didn't want to be sending a bunch of asymptomatic tests to the lab at this time. So it's based on a prioritization that we felt was important for the most essential testing to identify and work to prevent spread.
This is Paul Nelson with 2 News again. I know you mentioned that the National Guard's orders are going to expire in December. Do you expect that those will be extended under the circumstances?
I can't tell you, Paul. I'm afraid. I hope that they'll be extended. I know that there are talks that are occurring about extending the Guard's deployment, but I'm not in a decision-making role on that, and I can't project what that decision is going to be.
Will that be up to the governor?
I think it'll be up to the governor in conjunction with the federal government.
Any other questions for Kevin? Okay, hearing none. Thank you, Kevin, for that update. If you guys have any questions or follow-ups, please feel free to reach out. Otherwise, we'll see you next week. Thank you.